Hear the whispers from within, balance to restore, ailings to relieve. Feel the nature keeping us, nature healing us, flowers, leaves, and roots within. Hear the mind calming you, soothing you, love and kindness inside out. Let the herbs from middle world heal. Welcome wellness, welcome wellness. It's revealed herbs, middle world herbs.
Where we talk about restoring and maintaining your health in safe and natural ways while incorporating both the physical and emotional sides of healing. We go live twice a week right now we go live Fridays at 4 p.m. Pacific Standard Time, and we talk about a different aspect of health every single time. In today's episode, we're going to focus on mobility and joint health. We're going to talk with an expert about the causes of joint inflammation, swelling, pain, stiffness. If those are things you experience, you are in for the right show. We're also going to talk about gout, arthritis, and the secrets to aging without joint pain. My name is Deanne, and I am your host today. I'm here with our very special guest, Dr. Jacquie Leone, a naturopathic medical doctor, board-certified holistic nutritionist, and psychology enthusiast. So Dr. Jacquie, welcome. It's great to see you. And thanks for joining us on today's episode of Inflammation and Mobility. So if you want to just give a little background of like yourself and maybe anything that like you're excited about with this topic, that would be great.
Yes, I would love that. So when I was thinking about joints, joint health in general, it kind of took me back to my early practice days when I started this new injection therapy called prolotherapy, another injection therapy called PRP therapy. And it's essentially you're injecting either nutrients or specific healing cells into a joint that's been degraded. And it was kind of a little fringe. Science was kind of new, open to it. It had been used in athletes, but could it be used as a regular thing for people with joint problems and to rebuild joints? And we're going to talk about cartilage and tendons and things like that a little bit later. But what I found was it is an incredibly profound healing tool. And when I was reading up on joints and some of the stuff we're going to be talking about today, it really kind of reignited an interest in the joint injection therapy, but even more so into, I've been kind of getting an achy thumb joint and realizing that, you know, I need to start taking stuff and doing more things because arthritis and all that joint stuff starts now, you know, late 30s, early 40s. So anyhow, I just think that joints are very important. It has a lot to do with our physical health and when we're in pain, our mental and emotional health. So I am very familiar with joints, most joints. And I'm just really excited today because I think it's so common and so many people suffer from it. So, you know, what can we do to help? And I think the first line of defense is always information and education. So here we are. So when I thought about joints and practicing and all that good stuff, that's what I thought of. So there you go.
All right. Sounds good. Yes. Well, before we get started, I do want to introduce everyone to the two amazing joint support supplements that we have from Middle World Herbs. One of them is actually quite surprising. So we do have the joint support. That's not the surprising one. And then the other one is going to be our uric acid detox. So for those of you who fight joint inflammation, Middle World Immune Support with quercetin is also something to put on your radar for supporting your joints. And before we dive in, let's understand a little more about joints. So Dr. Jacquie, what can cause that stiffness in joints?
It's honestly so many different things. I mean, so many different causes, I should say, and causes that essentially just lead to joint inflammation. They all have joint inflammation in common. That's why joints get painful, they get stiff, they're more easily injured, right, is because of inflammation. Now, what causes the inflammation, is always unique to the person. The most common things that I would see in practice are injury and autoimmune disorder. So autoimmune is like rheumatoid arthritis and lupus, which are very highly linked to joint pain. And it's where the immune system is attacking itself, specifically the joints. But outside of that, it's usually some sort of injury, whether it is overuse, wear and tear, if you have the same job motion, let's say for 40 years, If you just tweaked it in an acute injury, like at the gym or hiking or doing something physically exerting, those are the most common reasons why we get stiff joints. And so we really want to address the underlying cause of the inflammation the best that we can. Because if I'm thinking that it's just wear and tear, but I actually have an autoimmune disorder, I could be doing things and taking things that are triggering my immune system and making the joints worse. So we really want to understand the underlying cause to the inflammation. But at the end of the day, inflammation is the culprit for stiff joints.
Okay, yes. And when you were speaking earlier, you had said your thumb, I think you said your thumb was starting to give you a problem.
Mm-hmm.
And it just like triggered in my head. There's a thing called mom's thumb, and it's like, and I had it one time, and it's from literally like repeated, like constantly picking up your baby,
Yes.
and like your thumb hurts, and it's real, and then it goes away. But actually, I know other moms that like had to wear like a little brace and stuff, and so it's
a
very
little thumb
common.
brace into the wrist.
Yes. Yeah.
Yes.
And so I never tied that to joints. I don't know why I never even thought that it had to do with the joint. I just figured it was like this weird like thing with your thumb. But yeah, so I think a lot of us experience this without even like realizing how important it is, and just the repeat motion. So what do you think caused your thumb issue?
I think mine's a multitude of things. I do a lot of body work, and so on patients and clients and things like that. And so repeated motions of certain body work and trigger point release. I also think just playing sports my whole life and having it dislocated a couple times, just paired with, I recently started learning how to play tennis, and I think gripping the racket kind of adds to it. It's kind of just like this aggregate thing where everything is adding to it, I think. And I just don't want it to get to the point of where my immune system is attacking my thumb joint, or I get rid of all the cartilage in there, which is the other kind of arthritis, osteoarthritis. So, I think it's the overuse thing, maybe I have mom thumb, but from other reasons.
You do.
I have a mom-like thumb. Mom-like thumb.
Mom-like
thumb. I mean, it's so true. We don't pay attention to our habitual patterns. Do you pay attention to the way you brush your teeth every day? I mean, that's like, 4 to 8 minutes of your day. Every day you're in that position. You're using your wrist the same way. You're using your fingers the same way. How often are you using your right hand over your left hand? By the time you're 50, your right-handedness is going to potentially cause some sort of rotation or lean in the shoulder or thoracic. So if we're not constantly shifting to make everything balanced and bilateral, it very easily joints get, all kinds of thrown off.
Yes, absolutely. We got a couple people jumping on. Abby's ready for another awesome show. Sweet. And then Eva says, not long ago, she was dealing with a frozen shoulder, which that sounds really tough. After 2 years, it finally resolved. Wow, Eva. Yeah. Wow, that's crazy. Well, I'm glad it resolved. And yeah, even like, this is so embarrassing to say, but I've had where you like, you're so hardcore scrolling your phone that like your thumb starts hurting. So that's a intense phone session of Instagramming or whatever. But yeah, it's like that repeated motion. And you're using the same hand. I'm not switching hands. So
exactly. Yeah. And that's what'll do it.
It's something
exactly. We need to really do that check-in. Like, how's my body feeling? Oh, this is more achy. I must have been flexing or extending it more than the other. Can I rely on that other one to pick up the slack? Do I need a break? Do I need to stretch it? So I just think a lot of people, we live in our heads and we don't take that moment to drop down into our bodies and do kind of a body scan, even for 5 minutes, just to check what is talking to us, what kind of needs our help or needs a break. And because we don't do that, over time, our body tries to keep up the best it can. But then, that's when things like inflammatory diseases like arthritis and stuff start, and then by that time, the symptoms and the discomfort can be so severe that we can't really do a whole lot to go back in time. We can prevent it from getting worse though, which is great. So that's why I really love the whispers that, I know it's not exactly the same, but I think that there's something to be said for the whispers because our body tries to whisper issues to us over time, and then it's going to scream, right? So I know it's a different intention, but I just like that the supplement has whispers too. I just think that that's so important. Makes some of the most profound things can come in the form of a whisper, So.
Mm-hmm. Like that so we really need to take preventative measures, basically. So what are
Yes.
some of the things that can help the stiff joints?
Great question. So I think it just depends on what the root cause is. So if you have like an autoimmune disorder, obviously getting that addressed and addressing that underlying cause, supporting the immune system, potentially getting on immune medications if that's helpful for you. There are definitely supplements out there. With gout, which is, another thing that can cause joint stiffness and pain. Uric acid crystals are forming in the joints. And so anything to kind of clear the body of uric acid, that's, addressing gout at its root cause. If we have overuse, wear and tear, or things like osteoarthritis, which is a wear and tear condition. So rheumatoid versus osteoarthritis is, what's the difference? The rheumatoid is the autoimmune. So that's how the cells are functioning. Rheumatoid means the immune system is attacking the joint. Osteo means bone arthritis, and that's where the soft cartilage between joints that prevents it from rubbing wears down so much that now the bones are grinding. Okay, and so one, the immune system is active, and one is a highly inflammatory wear and tear. So we're going to address different arthritises different ways, right? In terms of what can help. This is addressing autoimmune, and this is helping soften the joint. Maybe we need to lose weight because there's so much weight on the joint. Maybe we need to get the joint injections I was talking about. I know that that's helped me significantly, and I've seen it help people. Supplementation, diet, taking the stress off the joint. These are ways to help the osteoarthritis. Now, if it's a nutrient deficiency, some people who have fatty acid deficiency, which helps lubricate joints, or vitamin D deficiency, which helps with bone integrity, they've been shown to have joint pain. So what if the whole issue, we don't have any of the other stuff, we're just not getting enough of a certain nutrient? Then we need to seek professional care for somebody specialized in that can test for nutrient deficiencies, see if it's a dietary or supplement thing. So, there's a lot of different reasons that causes stiffness. So whatever your reason is, once you dig a little deeper, just make sure you find the right match in terms of care to address the root cause. But those are just a few things: supplements, diet, movement, and addressing the underlying cause.
That makes total sense. All right. Well, if anyone has any questions, throw them in the chat. I have a bunch. In fact, we're going to play a quick round of true or false. So everyone watching, feel free to play along. And let's see, Dr. Jacquie, I know you know the answer. So let's see if you get 100%. All right. So the first one is sugar can cause joint pain. True or false?
What do you think?
Well, I already played this game last Tuesday, so I think I remember. Well, you know what? I don't even know if I remember that one. I think it was it true? Is it false?
Reading on pins and needles. No, it's true. Of course it's true.
Clearly, I wasn't paying attention to this one. I remember most of them. I'll probably get like 90% right.
I had you guessing. Yeah, so so you kind of already know.
Second guessing.
For anybody who's like watching or listening who may or may not know, basically anything that causes inflammation is going to make joint pain worse. And processed sugar, white sugar, bleach sugar, that's just very highly inflammatory to the body, right? So the more sugar we consume, then we can safely assume that inflammation's happening, and exacerbating any other inflammatory process is happening. Maybe it's not joint pain for you. Maybe it's headaches. Maybe it's stomach stuff. But sugar just across the board is going to increase inflammation. So yeah, it definitely increases pain and stiffness in people who have joint problems. So stay away from the sugar. Sugar's a pain in the joint.
Oh, that's good.
I had a professor say that once.
Trying to do April Fools on me. All right, so the next one is all joints in the body are movable. True or false? And I remember this one is false because there's one like in your head, right?
Yes, ma'am. So
I'm like an expert now.
Yeah, you might as well be. So those are called sutures in our skull. Yeah. So we have what are called fontanelles, or areas or gaps in our skull when we are fetuses. And that's to allow for that pressure of the birth canal to allow the skull to pass through the birth canal. And then, the head flexes back and then those spaces between the bones fuse and become what are called sutures, which are immovable joints. Because as adults, we don't have soft spots anymore, right? They close up. So that is a great example of a joint that won't move. There are two other kinds, syndesmosis and gomphosis. Syndesmosis just means a non-movable fibrous joint, and it's where bones connect, like the tibia and the fibula in the leg. They are technically considered a syndesmosis joint because the way that they articulate is through really, really tough, tight cartilage. And then last but not least is gomphosis. And that sounds like, to me, you're saying that with a mouthful of gum. That's just how I remember it, because it's teeth, right? It's a peg and socket kind of joint that doesn't really move. Unless, of course, you are under the age, of 12, 13 and you lose some teeth to get your primary set. But after that, they should not move. So those are 3 types of joints that don't move in the body.
All right, good ones. All right, next one. Menopause can cause joint pain. True or false? True. No fun.
True, no fun indeed. So estrogen is the major female hormone that we associate with anyway. And estrogen is just produced significantly higher amounts before menopause. And one of the roles of estrogen for us, women, is to lower inflammation. And there's a few different theories, but estrogen is so high during procreative years to allow joints to expand, like the pelvic, girdle to expand, and for the joints to sustain that extra weight during things like gestation, pregnancy, birth, all of that to accommodate. And then when we no longer need to procreate biologically, God's gift is to take the estrogen away, and so you don't need to stabilize those joints as much anymore. So you're welcome for the joint pain and stiffness. Osteoarthritis is also more common because estrogen helps with different nutrients and bone density, so that's also an issue there with less dense bones. Pulling of tendons and ligaments and all that stuff that happens in joints can be more problematic because the bones aren't as strong. So yes, unfortunately, estrogen goes down in menopause, so joint inflammation goes up.
Something to look forward to one day. All right. That's what I'm going to hit in the joints apart hard. All right. Well, only older people get arthritis. True or false? I'm going to say I think it was false because I believe even children, right? Isn't there like something with maybe immune systems?
Yes. Good memory. And so about 50% of arthritis is diagnosed in people 65 and over. So that's why it kind of has the rep that it has, that it's like an elderhood disease, if you will. Because that's, 1 in 2 cases is somebody 65 and older. Then about 30% of cases is going to be 45 to 64. So the 20 years before 65. And then only about 7% of cases are younger than 45 and diagnosed. So it's a small percentage. But by no means is arthritis only for, only an elder disease or process that happens. So if you do get it, or, if it is basically diagnosed at a younger age or even in teenage years, most of the time, I would say very, very high prevalence is autoimmune disorder, like that rheumatoid arthritis that we talked about. And believe it or not, the cause isn't known. It's called JIA. Like JIA is its shorthand. It's juvenile, idiopathic arthritis. And idiopathic is the term in the medical community for nobody really knows. So anytime you hear the word an idiopathic disease or an idiopathic symptom, that's the medical term for we're really not sure. And so that's built right in the name because we don't know what causes it. But for some reason, it can trigger severe arthritis in people who are young. And in another super unique, if they are diagnosed, they can, in a lot of times, go into significant remission with almost no joint damage. And there's no correlation to if you get it when you're young and you get it when you're elder. It's almost like this little freak thing that happens, and then most of them clear it. Not all of them, but most, and so JIA is pretty crazy when you think about it, but
That is
short
crazy.
answer, no, it doesn't only afflict elderhood, but it is most prevalent for that age group. Yeah.
All right. And then we have dairy and gluten worsen the joint pain. True or false? And I'm going to just go with the obvious. True, because you said anything that's inflammatory, and those can definitely be.
You're so smart. Yes,
I
you're
am.
absolutely correct. Yeah, of course. So anything that's inflammatory, right? Now let's really, I might be a little, controversial in these thoughts, but I really want to take a moment in this question because it's a really good question and not vilify dairy or gluten. Now, I personally try to stay away from both. I'm more dairy, exclude dairy more, and I do have gluten a little bit more than I would dairy, but dairy I'm pretty strict on, because for me, I know how it affects my body. But I know a lot of people who can have one or the other or even both with little or even no reaction. So now that group is somewhat small compared to the people I know who do have a sensitivity to those things. So, I think that it's more common to be sensitive than not. But I do want to say that I don't want to vilify these two substances. And I do think it has to do specifically with your biodiversity, right? It's your body. And what's right for me might not be right for you. And what's right for you might not be right for your family members or partner or friends, and so on and so forth. So part of what I do as a naturopath is really connecting to each person's unique biodiversity. So in general, I'm going to say, to answer this question, that they do add to it, right? Dairy in all cases has usually a lactose component, which is a sugar. Sugar causes inflammation. Gluten causes a lot of sensitivity, bowel disturbance in a high amount of people. Celiac disease, which is like severe, not just gluten insensitivity, but intolerance. You cannot tolerate any gluten, is very common in people with rheumatoid arthritis and lupus, which are also joint problems. So those are linked. So there is a lot of connection here, but I do want to say take it with a grain of salt. And if your body seems to do okay with certain aspects of either of that food group, then don't remove it. Only remove it if you have, you notice a cause and effect. You notice that those things are triggering. And then by all means, definitely don't add insult to injury and try to remove them as often as possible. But, people can tolerate that stuff. So sometimes when I talk about dairy or gluten, because I don't follow it and I do think it's very pro-inflammatory, I also don't want to exclude people who can tolerate it and, make them feel like they have to change an aspect of themselves that isn't even a problem, if that makes sense. So short answer, yes, but not in all cases.
Okay. Yeah. No, those are good answers. We did get it. And if you guys are loving it, don't forget, you can always ask your own questions in the chat, and don't forget to follow us. That'd be great. So one question that came in is how much salt is too much? So what about salt and joints? Is there any sort of connection there?
So salt and joints, just because salt makes you retain water. So anytime you're increasing the water content in your extracellular fluid, meaning like between the cells, which is what causes edema and stuff, and when you get that puffy look or that water retention look, that's going to add stiffness to joints because it's going to swell the tissues around the joint. And when anything is space occupying, like it's just, this is how a joint moves, nothing's supposed to be there, and then all of a sudden we have stuff happening in its space, it's occupying the joint's space, the joint can't move as much because something's in its way. Even if it is soft tissue and something like water retention from too much salt intake, that can definitely be problematic for joints. More than anything though, high sodium intake is just not great for blood pressure in the heart. And tendons and joints don't really get a lot of blood flow. And if you're messing with the heart and hypertension and stuff like that from salt intake, it's just going to make everything that needs good blood flow suffer, right? Because the heart's suffering, and that's really the motor of the circulatory system. So anyhow, that's a really good question though. Salt, water retention, and joints. Yeah.
All right. All right. Next question. Cartilage and tendons can grow back if torn or damaged. True or false? True or false? I don't know if I remember that one. I'm going to say, I think it was a true.
Anybody else listening want to chime in? No. So the short answer is they can. Now it takes substantially longer and is significantly slower and more difficult, I should say, for something like that to heal. Just because, again, cartilage, tendons, ligaments. So real brief, because I think that this is important insight for anyone listening and serious about wanting their joints to be better. Just a super quick anatomy to help you out. This is a bone. This is a bone. The thing that's in between the bone to prevent the bone from rubbing, right? If this were like this, that's cartilage. So the bones can move, the joint can move, and it's got this soft little cartilage in between, so they're not rubbing on themselves. Now, the bones have to stay connected to each other because of a joint. So what's going to bind them together or connect them? That's a ligament. A ligament is just fibrous tissue that ties bone to bone. And then on top of this bone, now we need a muscle to insert on the bone to move the bone. Well, what inserts a muscle to a bone? That's a tendon. Okay. So we have the cartilage between, bone to bone is ligament, muscle to bone is tendon. And they're all very similar in their composition. They're all very fibrous, thick, tensile. They don't get a lot of blood flow, not a lot of oxygen exchange. They're meant to be kind of tight because they help protect the joint and hold the bones and all of that tension together, right? All the weight, all the utilization, all the hinging, extending, flexing, all that stuff is those things are in control of. So they have to be kind of tight like that, or built like that, I guess you could say. So anyhow, when damage occurs to them, because wound healing happens where blood flow goes and there's not a lot there. So when they get damaged, it's so difficult to get them to heal. So you can, and that's why I did joint injections and things, because it stimulates things in that area. That's why I highly believe in supplements for joint protection, because it stimulates specific factors for joint protection and healing. But if you, again, don't check in, don't do the body awareness thing, man, tiny little micro tears can turn into major issues and just chronic problems that eventually turn into arthritis. So please pay attention to the whispers, not to be redundant, but man, I worked on joints for so long in practice, Deanne. Please just love your joints, everyone. Once they're gone, it can be a slow, arduous move back. I messed up my shoulder hiking Havasu Pai once. And it took 2.5 years and a couple of injection therapies before I got, 80-90% mobility back. And it still clicks a little bit some of the time. So, joints are no joke.
Yeah, no joke. Oh, I want to do that hike too. That place looks so pretty. Okay,
so cool.
So I know, but I don't want to hurt myself. I want to do where you hike down and then ride the donkey out, right? I think they still offer that.
Okay, I got you one better. Hike in.
Okay. Yeah.
Enjoy the waterfalls, and then do the 4-minute scenic helicopter ride out so you get the birds.
Yes, I would like that too.
And then you don't have to worry about riding.
Like my husband.
The poor animals, they work so hard, and it's just.
Are they overheated and sad?
Yeah.
Maybe I'll do the helicopter. I'm down for that. I feel like my husband would shame me and be like, "Really? You're jumping on a helicopter?" I'm like, "Peace."
At least just one way. Maybe not both ways. Enjoy the hike at least one of the ways. Highly recommend.
Oh, I would totally enjoy the hike.
Yeah, if you hike in and you're hiking every day you're there, because from camp, every waterfall is at least 1/2 to 5 miles away. So you're hiking every day you're there to go see all the waterfalls. Some people, the last thing they want to do is hike out, and that's hard because the last 3 miles are switchbacks, almost straight up the mountain. So anyway, we could talk later, but I just didn't protect my joint very well, right? I overpacked my bag. I didn't stretch. I was a stressed out med student thinking I was taking a break, which I was, but it was I was just tense. And so everything is tense and, I didn't do the right thing. So you'll be fine if you just prepare.
Well, I don't have a trip planned yet, but I would love to. I will definitely prepare if I do it, and prepare by booking that helicopter ride out. Yeah. That'd be awesome. All right. So the next question is if we don't exercise much and we don't put a lot of wear and tear on our joints, are they going to last us longer? So that one, true or false? And I remember this very clearly. It is a false. You want to really be moving your joints. That's like the key. Movement is key.
Yeah. Movement is key. It's called, at least by physio friends, they say motion is lotion. Motion is lotion. Yes. So when we move, we're lubricating the joints, right? We're keeping them mobile. So there is kind of a sweet spot. It's called like the therapeutic dose when we talk about supplements and herbs. And I like to think of that when I think of exercising. So there's a special sweet spot in anything therapeutic where if you don't do enough, you don't see any results. But if you do too much, you can either have toxicity or you can have injury. And so you don't want to live, you know, in the outsides. You want to live right in that perfect little therapeutic window. And everybody's is slightly different for different substances and different lifestyle things like exercise, right? And then that tolerance changes over time. You're not going to lift the same weight 6 months into exercising as you are the first week of exercising because strength and joint integrity increase. So you want to just, as long as you stick in that window of pushing to any discomfort, challenging yourself in a healthy way, but don't push through it and cause injury because that can be problematic and add more to the wear and tear problems. Because I often see like really old injuries, people coming in at 60 and saying, oh, you know, I tore it back in college ball or high school ball and it was fine until 5 years ago. And then they have major arthritis in that knee because, you know, they fell outside the window. So as long as you stick in the window, you're good to go.
Okay, yes. Very smart. Okay, so then the next one is as we age, it's natural that at some point we're going to have joint pains and aches. True or false? And I'm just going to go with true. Like the older you get, it's going to happen.
Yeah, I mean, I think it's like relatively
college
inevitable.
Ball injury.
Yeah, it's true. You know, it's true. I think just aging makes us more vulnerable for most things because our body no longer has the defenses and the cellular turnover to heal as quickly as we're causing damage. And that's just part of aging. So what we have to do as we're aging is do things to hopefully prevent the degradation, like paying attention to the body whispers, eating the healthy foods, taking the good supplements, and being able to.
I'm laughing because I can hear James over you. James,
I know.
Hey, we can hear you. Guys.
James, hey, you want to mute?
That's okay. I'm like trying so hard to focus on the
word
awesome.
Jackie. He's having a full combo, and I'm like, which conversation do I pay attention to? But anyhow,
it just like brought me back to my news anchoring days where we have this like IFV in our ear and like you'd be reading like the most serious news story and like something bad would be happening in the production room and they'd be just like cursing up a storm and I'd be like trying so hard to focus on my script while it's like F this and you're like, oh my gosh.
I don't know if I could do that. That
was like a challenge. And then when he was talking, yes. I was like, woo, I can't even focus on what you're saying. Okay, so try again. So
seriously, my hat goes off to you because that's a big deal. I get very like auditory distracted. Like it's very easy for me. So the fact that you were able to do that is amazing to me. I'm impressed. So as we age. So it's kind of inevitable, but we can do stuff to soften the blow, right? So as you age, it's just inevitable. Muscles get tighter, tendons and ligaments get less flexible. Stuff takes longer to heal just because that's the nature of aging. So again, if you're doing all of the right things through the aging process before, during, the aging process, then you can soften the blow, right? You can make joint pain, maybe had you never done anything, it could be an 8 out of 10, really impacting your quality of life. Where if you take, the time, dietarily, supplements, exercise and movement, therapeutics, all that good stuff, stretching, massage, you will definitely probably stop some joint stiffness, but it's something like a 1 or a 2 out of 10. It's present, but it doesn't negatively impact your quality of life in your elder years when you should be enjoying yourself, So I think that's probably a big issue too. I see is people wait until their elderhood to get help. And sometimes it's a little, it's too late. We could do some stuff, but we can't move the needle. If you came in even 5 years before, even last year when it started, why'd you wait a whole year to come see me? So every day we wait on something like this is a day that we miss where we could definitely address the issue and get the help that we need.
Okay.
I'm
Yes,
done on
that's
that
smart.
soapbox.
I love that.
Yeah. I
And
think
you had
it's just so
mentioned massage.
important.
Does that really help
Yeah.
with the joints? Okay. I'm a big fan of
For,
that. So
for me
keep doing.
personally, yeah. I mean, so there are very different types of massage. Of course, come on, let's be honest. And this is no, I love massage therapists. Please keep doing what you're doing. God made you for a reason. Like you are a gift. But I think that something like a Swedish massage, which kind of stays on the surface muscles and doesn't really work at a deeper functional level, is great for relaxation. And anytime you can relax and get your nervous system to shift to rest and digest from like our fight or flight stress, that's going to induce healing, right? So maybe that doesn't work on the actual joint itself, but it relaxes us, which, indirectly helps the joint, right? Clear inflammation and stuff. But then you have actual things like rolfing and structural integration, therapeutic sports stretching, myofascial release. So those are all fancy words for really getting into the joint capsule and doing like manual movements on you, like you're just kind of sitting here, and they're literally on the origin and attachment of these muscles and tendons and ligaments around this joint, and then just moving and breaking apart any and all fibrosis and scar tissue, and really helping send good inflammatory markers to the joint to increase healing and stuff like that. So inflammation isn't always bad. It's just when it's too fast for the body to clear or address, that's when it starts to degrade. But without inflammatory markers, our body wouldn't know where we need to heal. So a little bit of intentional inflammation with something like therapeutics like that is going to be very helpful long term, because that's how your body knows what to clean up and what to sweep up. It just can't clean up 12, 10 out of 10 red inflammation here. It can't keep up with all that. But if we're generally eating well, we have a healthy lifestyle, and then we have some joint issues, if we do those therapeutics like that, then the brain will say, oh, hey, we need to really address this guy. And then there's only like one foghorn in the body instead of 10 going on, if that makes sense. So I highly recommend body work. Highly recommend body work for sure.
Awesome. You don't have to convince me. I'm in.
Yeah.
Although even the ones where it does hurt, like it hurts so bad, but then afterwards you feel so good. So
yes. So you get it. So have you gotten like intense structural work then? Sounds like.
I don't know that I've gotten like the hardcore stuff, but I always, and I don't know how to say this without sounding like wrong, but like Asian style massage is like they go deep and is that it? Okay. And they're so affordable. And so I go and get that like all the time. And they'll even incorporate sometimes like the Thai massage where they stretch you. And I'm like the most inflexible person. I think they literally like laugh when they try to stretch me. But that's all stuff that I think is really, really helpful. And if anything, it does relax me and turns me from that fight or flight to like a chill at some point. So I'm a big fan of it.
I love that.
My little like punch card.
So many different levels. Yes. Oh my gosh. Thank you for doing that for yourself. Like
yes.
Sincerely.
Oh, and I just bought a foot massager off of Amazon, so I'll give a shout out to Amazon. And that was like the best $100 I've ever spent. I literally sit every single day, and it's amazing. I'll send you the link. It's so good, and it's just like really high pressure foot massage. So it's been really good.
I love stuff like that. Oof. The feet and reflexology,
self-care.
That's a whole other thing. But yes, I love feet stuff. I think it's so important. That's our base. Everything, reflects how good that base is,
If it wasn't loud, I'd be sitting here right now doing it. It's not like loud, but it's enough for it to distract me. But I thought about it the other day. I was like, oh, what if I had my foot massager going during our interview? And then I was like, that's a little loud. So,
hey, if I can't tell,
all right.
Feel free.
You wouldn't be able to tell. I think our audience would be like, what is that noise? All right, we did get a couple questions in here.
It's called self-care.
So we have Abby's
white noise.
self-care. Yes. It's so important. All right, Abby wants to know, how beneficial is cold hot therapy for joint pain? I think that's even a question coming up, Abby. But yeah, tell us.
Question coming up? Look at how intuitive.
But she can answer it.
Abby.
I know.
Okay, that's a great question. So both are good, but cold tends to be better when it comes to inflammation. Now, heat is going to dilate the vessels in the area, bring blood flow, and in blood is nutrition, oxygen, and all the stuff that we need to heal, right? We need to take the bad stuff away and add good stuff in its place so we can heal, and all that stuff can start to restructure itself. So it also causes relaxation, heat around the muscles. And then cold is going to kind of come back and restrict. It's going to constrict the vessels and take all that blood that was just in the joint and pooled and nice and dilated, and all that gas exchange is happening. Good stuff is going in, bad stuff is coming out. Well, now that blood is kind of pooled there and it's just full of all the bad stuff. So that's when we slap cold onto it and everything constricts and everything is pumped away from the area back to the heart and lungs to be reoxygenated and nutrified. And so that it's the hot and then the cold constricts and then the hot and the cold. Cold is much better though at swelling and inflammation. And think about it, when we get inflammation, it's just like, your joint will swell up. It's just, that's what happens in an inflammatory response, is just everything gets swollen. And so ice really helps prevent that from happening. So again, we want some inflammation, but we don't want it so out of hand that it's uncomfortable or painful to the point of, preventing our utilization of the joint, right? But we need a little bit so that healing can occur, and ice is good for keeping inflammation right in kind of that sweet spot. So generally speaking, ice is better for inflammatory pain, but the contrast hydrotherapy, which that's the fancy term for adding hot, then cold, then hot, and then cold, and doing kind of rotations of that is even more helpful than ice alone. So cold first, hydrotherapy first, cold, and then hot. That would be like the hierarchy of how effective things are. Also, again, I'm going to say it, stretch and massage, that's going to be huge for the joint. Anything to just move that joint around, get new fluid exchange is going to be ideal. So hot, cold, contrast, 5 hot, 2 cold, 5 minutes hot, 2 minutes cold, 5 hot, 2 cold, 5 hot, 2 cold, done, and on cold. 3 rounds. We really want to create that pumping. Okay. And if you try it, let me know, because I feel like it helps substantially with aches and pains. And it's only like 20 minutes of your day. And you could just be like pain-free or significantly lower the pain moving forward. So yeah, if you try contrast, let me know out there.
Okay. Yeah, that's cool. Okay. Eva wants to know, her chiropractor advised against heat from electrical blankets, but to use moist heat. Have you heard of any merit to that?
So when we think of electric heat versus like water heat or like a hot pad, let's say, like not a heating pad, but like one you might put in the oven or in the microwave, that, the whatever substance inside the pad is getting hot. It is a different thermal versus electric. So as far as I understand, it's kind of the difference between the sun and a tanning bed. For a good example, is like they both kind of get you the same outcome in a different period of time, but one is going to have more benefit than the other. That's how I would. Now, if in a pinch, all you have is a heating blanket, like a hot blanket or electric blanket, or heating pad, I would rather you do that. But if you have hot running water, or if you have a hot pack or a hot towel, something like that, that is definitely preferential. Because it's not a synthetic heat, and the heat will calm and cool as your body takes on the heat, versus radiant heat or electric heat where it continues, right? There's no, if you put a hot towel on your leg in 10 minutes, the heat will go into your tissue and then the pad will cool down. Where if I left a heating pad on my leg, it would be just the same temperature. And so our body needs to go through that natural process of dilation and then kind of calming back in, and then the cold, right? But in electric heat, we don't have that because it's so consistent. We're not having that bio change, that adaptability in the circulatory system. So it's a little different. And I prefer, like the water heat, I guess you could call it, like a hot towel, or even putting your feet in a bucket of hot water. That's why it's called hydrotherapy. Hydro means water. But again, if all you have is something electric, go there for sure. I'd rather you do that than not do it at all.
That's so interesting. Okay, we also had a question on Facebook, which is, and Christine, if you're still listening, how can we naturally relieve headaches?
Oh, that's a good one. Headaches are kind of like when you asked me about joint stiffness. It's, so many different underlying causes, but one of the main causes is inflammation, right? Or I should say the issue is inflammation, but what causes that inflammation could be so many different things. So riboflavin is B2, and B2 deficiency has been really high in people who are migraine sufferers. So that's a nutrient deficiency, for example. Autoimmune disorder can definitely add to headaches and migraines or migraines, things like that. If you have any sort of trauma or history of neck issues, slip discs, neck shoulder pain, clenching of the teeth, just anything kind of in the area that's going to constrict the blood flow going up into the brain. So if you have a tight neck, think of like you have two hoses that are just feeding the brain, fresh blood. You're thinking glucose, energy, nutrients. So, well, if these get pinched off because I have a really tight muscle, like in front of and behind, and so it's kind of closing the diameter a bit, or because my neck, I'm compensating with my shoulder up, that's going to pinch the hose. Anything that pinches the hose prevents blood flow from getting to the brain. Lack of blood flow causes pain, right? And causes headaches, causes migraines. And so we want to really address any structural issues that are impeding blood flow. Now, if we're using hydrotherapy to address a headache or a migraine, that's a great way. We can divert blood flow from the brain to take the load off a little bit. So we're not like, when you hear that, you feel that throbbing pain, that your own heartbeat in your head. That's usually because there is some sort of pinch or collapse or, issue happening. Maybe it's from inflammation. Maybe it's, again, from something being tight. But the issue is that thumping is there. So how do we relieve it? Well, we have to kind of help get so much blood and tension and everything away from the face. So doing the hydrotherapy where you put, and I know this sounds counterintuitive, but stay with me here. You put a cold pack around your neck, okay, just to help the inflammation, just short term. And then you do a hot foot bath where you have hot water, hot towels, hot socks, whatever, up until like mid-calf. Now what's going to happen? Okay, you put the ice pack on, you have your feet in a tub. Wait about 5 minutes, take the ice pack off. What's going to happen? All the blood and tension that's stuck here is going to be pulled down because your feet and your legs will be dilating the vessels. They will be asking for more blood because they're in a hot environment, causing pooling and dilation, pulling blood from upper extremities, the neck, the head, things like that, really helping kind of pull back some of that tension. And then after about 5 or 10 more minutes of that, then you put your feet in cool water, not cold, but cool, and it will relieve the tension from the top down. I've relieved a lot of tension headaches this way. It sounds counterintuitive, but I promise it works. So if you try it, let me know. But those are just a couple of things that spring to mind when I think of headache and migraine support.
That sounds so cool. I've never heard to do that. I love that idea. So thank you. And the way you described it was just awesome. Okay, so talking about like hot, cold, there's this leading into our next question. Some people say that if you have arthritis, you can like forecast the weather. So basically on their level of joint pain. Is that true or false?
Yeah, actually sometimes for sure. So when we think about what's happening with weather changes, so we think of like air density, and air density tends to be thinner when it's warmer outside and kind of thicker and dense when it's cold outside. And that air or change in that is happening inside the joint as well, right? And so if things are there's going to be more density and cooler air outside the joint, inside the joint, more space occupying gas molecules are, at a slower velocity. And so any fluid in big joints slows down, the viscosity gets thicker. It's just think of stuff. What happens when it gets cool? What happens to anything? Everything kind of slows down, gets sludgier, thicker, cooler. And that's what's happening in the joint. And that's why it can get stiff. So joints can be red, hot, inflamed, and painful, or they can be cold, slow, low, stiff, and tight. And those are really the two sides of the same coin that is joint pain. But yeah, you can definitely forecast the weather if you have bad enough arthritis. If you're, that one knee starts sticking, that we're in for a cold front. And I'm laughing because I think it's crazy that our body can be so connected to its nature, but it's not really that funny because it is like really detrimental. Some people can't live in certain geographic settings because of their bodies. And so it's not funny, but I do think it's kind of cool all at the same time, if that makes sense.
Yeah, it explains why there's so many like over 80-year-olds in deserts and in the warmer climate locations. So
Why
makes
everybody wants to
sense.
come south. Yep.
Yes,
That's a big
yeah.
part
I
of
mean,
it.
I'll probably
That's
go
a
move
big,
to the
big part
desert
of
when
it.
I'm old too.
Yeah.
All right. So, well, give me the heat. All
Yeah,
right, the next
really.
one is gout. Gout only happens to older people. True or false? I'm going to say it's false just because only, the word only, I think it
Yeah,
typically happens to older people, but not only.
exactly. Exactly. Welcome to the world of medical school, because that makes it wrong, right? Now, if it said gout happens primarily in older people, then we would have a true statement. But because it says only, right, anytime we're doing severity or extremes, chances are it's usually not true because it doesn't take into account the gray area. But usually the chances of getting gout do happen the older you get. But unlike arthritis, which is older than 65, right? The majority of people who get diagnosed, gout is actually diagnosed between like 35 and 50 most commonly. So it's slightly younger, but it's not as common, as arthritis can be in that JIA, the whole juvenile arthritis, idiopathic arthritis. Nothing like that happens with gout as far as they can tell. It's possible, but it's very rare.
Okay, we got one more question from Facebook. Can you talk about treatments for a fissure or articular cartilage? Oh my gosh, I can't even talk in the knee. Did you get any of that?
No.
Can you talk
Can you
about
please
treatments
ask
for a
again?
fissure or articular cartilage in the knee?
Articulate cartilage, what?
In the knee? Of the knee? In the knee?
Oh, in the
Should
knee.
they
Articulate
re-ask that?
cartilage.
Yeah.
Okay, I was like, So, I mean, talk more about it in anything particular?
Any sort of treatment for that?
Okay, so anytime we're working with, again, cartilage, we have to remember that cartilage is very rarely can grow back, and it's slow and steady. So if you have a cartilage issue and you know for sure because of imaging or post-surgery, or you're just working with the doctor that you have cartilage wear and tear, then that's when I highly suggest looking into injection therapies, to be honest with you. Now, if you have a little joint stiffness and you want to prevent the actual cartilage from being deteriorated, that's when food and supplements can still have a huge, huge impact. But by the time the cartilage itself is already degrading or you're showing like loss of cartilage, to me, yes, food, supplements for sure. You got to do the background work. But something that can kind of help address it and do a little more heavy lifting will be those joint injections. So when we're talking about joint injections, the two that I would look up if you are having issues, one is called prolotherapy, and one is called PRP therapy. PRP stands for platelet-rich plasma. I don't know if you've heard it, Deanne. I know it's super popular out in California, but they also use PRP with a micropen for anti-aging for face to support collagen and fibrin. So you can
the
actually
vampire face.
Exactly. So yes, that's why they call it the vampire facial.
Yeah.
Yeah, exactly. So they call it the vampire facial. It's kind of a 2-for-1 because they draw your blood, spin it down, take the growth factors, and then it keeps you looking immortal. So that's where they got, the term vampire facial. But you can have vampire joints. No, that's trademarked. I shouldn't say that. You can have therapy, the same intentional therapy done to joints, and instead of, because PRP is a stem cell. You put it in your face, you're going to grow collagen and elastin and skin, you're going to heal your skin. But if you inject it in a joint, you're going to get more cartilage. You're going to get synovial fluid production. You're going to get the bone, tendon, and ligament all repairing itself, right? And so to me, if it's to that point of degradation, then we need heavier lifting. But if it's just achy, painy, eat well, supplements, do the stretching, do the massages, doctor's orders for massages.
Yes, I love that. You should trademark vampire joints. I don't think that's trademarked. I like that. My friend got a vampire facial. I did not, so I can't speak from experience. They
Oh,
do
I used to do
intrigue
them
me.
all the
Although I've
time.
heard that
Yeah.
you've had him.
Oh,
Oh,
I would
cool.
do them in practice, and I've had a handful for sure. I mean, I own a micro pen, and I, used to do them all the time. I would say about 70% to 80% of people had amazing results. And then the other 20 to 30, either little to no results. It really depends on the person and what I'm working with. Like, what's the quality of your stem cell? Are you smoking a pack a day,
Wow.
drinking a bottle a day, and eating fast food all day? The richness, the population, the strength of your stem cell isn't going to be as strong as somebody who takes a little bit better care of themselves. They're stem cells at the end of the day, so they're still going to do a little bit of work, but it just depends on who that person was and the quality of the PRP. So if you are going to
Okay.
get PRP for your joints, highly recommend taking a month and like focusing on good health, wellness, and all that stuff, making sure that the stem cells integrity is there and it can do its job for you.
Yeah, oh, that's good advice. Okay, I love that. So, everyone, if you're enjoying this, hit the follow button right now and then follow us on Instagram, Twitter, TikTok, YouTube. It's at Middle World Herbs. Okay, so Dr. Jacquie, next question. What's like the most common joint in your practice that's mostly injured? Like, what are people coming in with?
Honestly, shoulder, knee, and ankle. I mean, those are the most common. I think anything that is, I get some hip stuff, but not a ton. It's more, like rolling an ankle or sports with the knee, sports with the shoulder, or over mechanics with the shoulder. Sometimes elbow wrist stuff too, with like golfers or
Mm-hmm.
tennis players. Tennis elbow's a thing, golfer elbow's a thing.
Mm-hmm.
Um, so it's unique to, I think, the person, but it's usually shoulder, knee, and ankle are the most common that I've seen.
All right. Well, let's talk a little bit about our joint support supplements. So, this is what the bottle looks like. You're going to get 1,200 milligrams of chondroitin, 1,500 milligrams of glucosamine, and 2,000 milligrams of MSM per serving. And Dr. Jacquie will help demystify those ingredients in a few moments. But I just want to say it is brand new to our family of products. And with all the work leading up to it, it finally landed here in our Amazon store in January 2022. So the bottle includes 60 veggie capsules, and the full dose is 5 capsules a day. So this is basically a 12-day formula for yourself. And that's why it's only $13.99 on Amazon. So it's basically supporting your joints for like $1 a day. And then I have really good news because you're in this live, you get that additional 20% off. So click that little banner, and that's going to bring the price down to $11.19. So less than $1 a day. But you have to get that while we're live to get that additional 20% off. So let's just talk a few minutes about the 3 powerful ingredients, the chondroitin, the MSM, and the glucosamine. So Dr. Jacquie, where are those compounds from, and what do they do?
Really good question, because I think a lot of people, especially in the joint world, you kind of hear these fancy words, but you don't always know. And chondroitin is, to me, it's a fancy word for cartilage in animals. To be honest with you, chondroitin it's a complex sugar structure, but it's produced by the cartilage of animals like cows, pigs, and primarily sharks is where we get chondroitin supplementation, just because the integrity of their cartilage is so similar to us in the way that we assimilate it when we take it. So chondroitin is cartilage. We're just taking what our body needs to rebuild. Now, glucosamine on the other end is something, it's a sugar and an amino acid that comes from shellfish. So the exoskeleton or the shell of shellfish. And because of the integrity of the shell of shellfish, how hard and structurally sound it is, that's why glucosamine is harvested from that and how it can help us. And then last but not least, MSM is primarily just from fruits and vegetables and other food products. So things that are really high in MSM are going to be like coffee and tea, which coffee in moderation, I think, but tea, as long as it doesn't have a lot of caffeine, especially herbal tea, is going to be fantastic. Believe it or not, beer. Hopefully that doesn't sound like a free license to just drink a ton of beer. But when you are having a beer, if you do enjoy beer, know in the back of your mind there is a little bit of MSM that you're getting for your joints. And then things like alfalfa sprouts, really dark leafy greens like your spinach and kale, apples, tomatoes, these types of things have naturally occurring MSM in them. And they're all
Okay,
just meant
awesome.
to work together to, yeah, support joint health essentially and help rebuild.
Okay, cool. And allergy warning for people, that does remind me.
Yes.
They're extracting some of this formula from lobster, shrimp, and crab. So if you have a shellfish allergy, skip this one because you'd be allergic to it. All right, well,
Yep.
let's focus for a minute on cartilage. So what is it, and is it something that our body can easily regenerate? And you had kind of said earlier that it's a very
Yeah.
slow process when we
Yeah.
regenerate.
Super slow. And it's just because cartilage is a flexible connective tissue. So it's kind of flexible, but it's tensile strength, like the way it's woven together. Think about it. When you have like a really loosely woven kind of blanket, it doesn't have a tight weave. The integrity isn't as strong as something that's woven together really tightly, right? So cartilage is just that. It has a very tight tensile strength. Which makes it awesome at its job, but also makes it hard to heal, right? So it just keeps joint motions fluid, nice and smooth as we do different things, walk and talk and lift and move. And it just coats the surfaces, like I said, of the bones of the joints and cushions them against different impact. It's like the shock absorber of the body is cartilage, inner joints. And like I mentioned before, it's just so slow and steady if you get an injury in the cartilage. So you really want to stretch. Pre and post stretch, pre and post hydrotherapy if you can, for joints to prevent that kind of injury, like a cartilage tear. But yeah, without going down that rabbit hole again, it's super slow and steady, but it's possible.
Yoga, lots of yoga, hot
Yeah,
yoga, cold yoga. I don't know, yoga.
all the yoga.
Okay, so all the yoga, all of it. So with the joint support, with the MSM, the glucosamine, the chondroitin, who should and who should not take this?
That is a great question. So when it comes to, I think it kind of goes without saying that, like you said, anybody who's not vegan, right? Or anybody who is vegan, pardon me, if you're getting a supplement from an animal source, it's not a vegan source. So if you are vegan or plant-based, just be on the lookout. There is new research that there's chondroitin coming out from fermented microbes. But, science still hasn't supported that super strongly right now. Who knows what the future holds? So they are working on vegan products like this. So that's just something to be concerned about. The second thing, like you already mentioned, which I was going to mention, is the shellfish allergy. Don't take glucosamine or any derivative of any shellfish if you do have an allergy or sensitivity. Also, glucosamine has been shown in some people to increase blood sugar or blood glucose. So if you do have type 2 diabetes or diabetes at all, or pre-diabetes, just make sure if you're going to take something like glucosamine, pardon me, if you're considering it, just make sure to talk to your doctor first so that you can get approved from them and make sure it's safe. Because we don't want to mess with blood sugar if you're working on managing that. And then last but not least, it interacts with blood thinners and certain cancer meds. So if you are on something like warfarin, Coumadin, something like that, or if you're on doxorubicin or any other cancer drugs, be really careful when you're taking anything like glucosamine or chondroitin or MSM. Yeah.
Okay, sweet. Well, one of the things that you get when you buy any of the bottles are these cute little whispers, and basically it's a positive word or mantra or inspiration, because we really believe that healing is not just physical, it's also emotional. So mine here says a body in motion stays in motion, but you get a different one each time. And one thing to think about is just, and I want to ask you, Dr. Jacquie, with joints and mobility, is there a connection between our emotions, like stress or anxiety, and joint health?
Yeah, I think that just because we're inherently, the mind-body connection is an inherent link. One affects the other, and vice
Mm-hmm.
versa, right? When our body is going like fighting illness, it can affect our mind. When we're struggling with things mentally or emotionally, it can show up in our body as aches and pains, or headaches, digestive issues, and all that. So there is definitely an inherent link. When I think about joints in particular, I think that anytime you're just in a stressed state, and when we get stressed, what happens? We become on guard, right? Everything tenses up. All of our muscles, and our muscles, when they tense, they pull on joints. That's because they're connected to joints. That's just how they work. So if we have tension at work and we're typing on a computer, all this neck and stuff, we might clench our jaw, we might get neck pain, we might get headaches. If we're sitting, on a chair all day and our hips are flexed all day, we might have low back pain. If we're doing, again, mom thumb, the same repetitive motion over and over again, that's gonna cause an issue. And put more and more stress on the body. So not just emotional stress, but physical stress. And then we're less likely to be able to handle the physical stress, because it's hurting. And then our mental health is negatively affected, which makes us showing up for that same job or that same motion harder. And so it's kind of this vicious cycle. And so anytime, again, back to the massage talk, anytime we can get in rest and digest, we can move tracks. I think of the nervous system like an old railroad track. And you know how they can like pull the lever and it shifts, it switches. That's what I think of. So if we're headed down this road, right, sympathetic of fight and flight, we're tense, we have no blood flow to important organs, we're unable to focus and problem solve as efficiently. We're not absorbing nutrition. We're not assimilating nutrition. Like, our body is just focused. The only thing it wants to do is keep us alive. That's literally it. It's not going to worry about anything else, especially not protecting a joint. It's just like, I need to get out of the situation. And so when we can shift into parasympathetic or rest and digest, we're now absorbing nutrition to feed joints. We're relaxed. So the tension moves out of the muscles that hold that joint. That's just going to be so helpful for so many things, but in particular, physical health, physical relaxation, physical joint release, right? And that's when we see lower joint pain. And people who make concerted effort, focused effort on being able to relax, intentional relaxation, at least 10 minutes a day, significantly lessens the development of a lot of chronic joint issues. I mean, outside of diet and supplementation, of course, because again, the other side of the coin is the body. But when we're talking about that mental, emotional piece, for sure, we need to relax. Relaxation is where healing takes place, for everything. So yeah, I definitely think that there's mind-body connection around joints. Thanks for asking.
Cool. Well, give me a doctor's order. Relax and all right, so we have less than 10 minutes and we have one more really cool supplement to share. So this is our uric acid detox with tart cherry and pomegranate. And top secret, this is our #1 seller. So in addition to tart cherry and pomegranate, the formula also has a whole bunch of other really good herbs like celery seed extract, green coffee extract, milk thistle. There's cranberry, yucca, devil's claw, turmeric, to name a few. So you're going to get 60 veggie capsules, and the suggested dosage on this one is going to be 2 veggie capsules. So you just take 2 of them daily. It's available for $15.99 on Amazon. And since you're watching this, you're going to get that 20% off bonus. So take advantage of that bonus and purchase it during the live right now. So Dr. Jacquie, this might seem kind of unlikely to talk about uric acid when we're talking about joint health. So what does this have to do with joints?
That is an awesome question. I definitely think they're highly related. And the reason is because uric acid, when it accumulates, it shows up in joints as gout. And gout is another form of arthritis and joint pain. It's its own class, but it kind of falls under the same umbrella. So when we eat like animal products, lots of shellfish, lots of different, or seafood, I should say, we basically are ingesting these things called purines, normal purines, right? Everybody eats a combination of them every day. Now, what happens when your body eats them and breaks them down, one of the byproducts is called uric acid. Now, uric acid, the kidneys can clear fine, no big deal. But just like any, inflammatory process or any disease process, when we're filling up the bad too fast, then our body can clear it out, aka uric acid in this case. It adds up. It aggregates, and where does it add up? It adds up in our joints. The big toe is the most common for gout, followed by the ankle, right? Just move up the chain, and then the knee. So starting from the ground up. Because there's most tension on the big toe, then on the ankle, then on the knee when it comes to the way that we're walking, standing, moving, running, lifting, anything like that. So it's super important, I think, to support the body to clear things like uric acid. So when uric acid crystallizes, it gets really jagged. It's like this little saw. So imagine like a ton of crystals with saw-like projections inside your joint cavity. Ouch, right?
Ouch.
Ouchie.
Oh.
Yeah. So we definitely need to work on clearing uric acid when talking about joints, because it can directly affect joints in the form of gout for sure.
Okay, and then the ingredients in here with like the tart cherries, pomegranates, milk thistle, turmeric, that all helps with those crystals and helps the kidneys.
Oh yeah. Well, the number one thing that supports uric acid breakdown is vitamin C. So what it sounds like, all those red berry fruity things that were listed, pomegranate, tart cherry, cranberry, all these things, super high in vitamin C. So right away, go ahead. What was that?
I said there's even citric acid in there. Yeah, like everything with vitamin C.
Yeah. Ascorbic acid is another way of saying vitamin C. So anytime we have vitamin C, that's going to help the breakdown because it's an antioxidant and specifically helps, break down uric acid. Now, outside of that, when we have too much uric acid, it can also affect the liver. It can affect the kidneys. And so milk thistle's in there, which is going to help the liver. That's a liver specific. It's called hepatoprotective. Protects hepato. Hepato is the Latin word for liver, right? So it's built right in the name. Protects the liver, which is awesome. But then when we look at like the Chunkapedra, right? Say that 10 times fast. That has actually been shown to reduce gout attacks or the amount of uric acid that can build up in a joint. Because it decreases uric acid levels, and it's been shown in human and in animal studies. It's specific to uric acid, not just, hey, I have a whole lot of vitamin C that can secondarily help clear uric acid, but no, my primary action as this herb is to cut down uric acid. That's the number, like I have ingredients in me that are specific to that. And then last but not least, when we look at something like devil's claw, that research is just substantial on devil's claw. Devil's claw is pretty awesome. So it eases gout symptoms because not only is it anti-inflammatory, but it binds to and helps carry out uric acid. So lowers uric acid level. So the combination of all of those things that are working toward a common good, I mean, it's bound to be, effective. So.
Awesome. And just so everyone knows, these are made in a GMP certified facility. Like everything is tested for purity. So these are like top rated supplements. And also every time you buy a bottle, a tree is planted. So that's super cool too. Well, as we wrap up, what are like the 3 things you want to leave people with today?
Oh man.
There's a lot.
Well, I mean, we just covered so much, right? But I think the first is pay attention to any signs your body gives you. You're not weak for going to the doctor because your hip has hurt 6 weeks. If something hurts you longer than 6 to 8 weeks, it's going from acute to chronic. It's gonna only get worse. So please be kind to yourself, be your own friend, and if there's something nagging at you, ask for help, professional help. Tell somebody important to you what's going on. Maybe they can help you get on like a stretch regimen or something. Just please don't be afraid to ask for help if you need it. That's number 1. I think number 2 is if you do have chronic joint issues, like giving yourself those moments to drop into your body, right? Asking for help is huge, but we can't ask for help if we don't know how extensive the problem is. And we only know how to communicate the problem or how extensive it is if we fully experience it. And it's hard for a lot of people to fully experience their body. There's a lot going on in there. The body remembers almost everything we've been through. Traumas, pains, aches, it's there's a lot is my point. But by tapping into the body and creating a relationship of awareness, we can catch things so quickly, because then that moves me back to point 1. We're not afraid to ask for help. So ask for help, self-awareness. Maybe I should switch those around. Self-awareness, ask for help, really checking with the body regularly, ask for help. And then foundations, really stick to foundations. 3 things. Motion is lotion, move your body, even a simple walk 10 minutes a day, right? Food is medicine. Please remember that. Use the things you eat to heal your body. And third, but definitely not least, is any additional therapies, supplements, hydrotherapy, acupuncture, massage, anything like that that's going to help you Find what works for you and do it. Okay? So self-awareness, ask for help, and create a foundation for health. Those are my 3 things.
Those are good. Well, you had a couple extra bonus ones in there, but we'll let them slide.
I did. It was like 3A, 3B, and 3C.
3A, 3B.
All right,
3C.
I get it.
No, I love that. Give me your top 20 right now. Yeah, so much good stuff. Thank you, Ashlyn, too, for saying that. And everyone, make sure you hit the follow and be sure to watch us every Friday. We're on every Friday at 4 p.m. Standard Time. It's awesome. We always have different topics. We have a lot of fun, and we love your questions too. So we're going to wrap up here. So we'll hopefully see you guys all next week. Don't forget to check out with your supplements. Get that 20% off. Thank you for the follows. You guys rock. And yeah, Dr. Jacquie, if there's anything else you want to say, go for it.
I just want to say thanks for taking the time and everybody sharing their time and energy and space with me. I love it. I appreciate it. And I appreciate you. And hopefully something that we talked about today will help. And yeah, just definitely follow if you want to learn more information. Otherwise, I will hopefully see most of you the same time and same place next week.
Awesome. All right. Bye, everyone.
Bye.
Hear the whispers from within, balance to restore, ailings to relieve. Feel the nature keeping us, nature healing us, flowers, leaves, and roots within. Hear the mind calming you, soothing you, love and kindness inside out. Let the herbs from middle world heal. Welcome wellness, welcome wellness. It's revealed herbs, middle world.